The doctor is in. COVID-19 pandemic affected just about every aspect of life, including screenings, treatments, and follow-up care for breast cancer patients. Now, many patients delayed or skipped regular screenings due to COVID-19 fears. Joining us now is Dr. Bindiya Gandhi, the medical director of Revive Atlanta MD, to discuss the need for regular screenings and care. Welcome to Bloom, doctor.
Thank you for having me.
So now more than ever, I would imagine these screenings are critical.
Yes, they are. They definitely are. It's important that women continue to get their yearly mammogram screening.
So at what age should they start the yearly mammograms?
So, there's been some mixed data on when women should start. We were telling women to start at age 40, but now we're actually recommending that they start at age 45. So studies are showing that between the ages 40 to 44, there's less detection of breast cancer. So my recommendation is all women at the age of 40 be offered, especially if they think they're potentially may have a risk for having a mammogram, but definitely every woman after the age of 45 should be getting a mammogram.
Now, are there other screening measures that we should think about? I mean, obviously, we talk a lot about breast self-exams. How often should women do those?
So, again, we used to tell women to do breast self-exams monthly around their cycle, but you know what? We no longer recommend that because there's a lot of false positives that come with that. Sometimes women are feeling just fatty tissue or, maybe a lump that they think is there, and it really could just be calcium deposits. And what ends up happening is they're getting unnecessary biopsy and they're causing a lot more anxiety. So that is no longer recommended.
So I know my mother was a breast cancer survivor, and I've been told that puts me at a higher risk. Is that true? And are there other women that should be concerned that are in the high risk zone?
Yeah, so family history is definitely puts you at a higher risk for breast cancer. So I always encourage patients to figure out, did a family member have it, and genetic testing, that may be a good option for you to do. Other things that can make you high risk is if you smoke, if you drink, if you are overweight, if you started your cycles at a really young age, or you went through menopause at an older age, if you never were pregnant, if you're exposed to radiations, any chemicals, DES. So there's a lot of factors that can increase your risk of having breast cancer.
Yeah, you just mentioned quite a few of them. Is there anything else that we can do? I mean, nutrition-based, anything to try to avoid our chances of, becoming a breast cancer victim?
Yeah, managing your weight is a big one. Obviously, avoiding smoking, avoiding or limiting alcohol use would be a big one. But staying active really does help a lot. Exercise makes a big difference. But, not using so many chemical products. There's a lot of exposure in BPA, phthalates, in hair dyes, in relaxers. So avoiding chemical exposure really makes a big difference. But just overall, trying to eat well, eating a lot of whole grain foods, a lot of fiber in your diet, organic when possible. All of that will overall reduce your risk.
And what about women with implants? Should they get extra screening?
They don't necessarily need to get extra screening, but they definitely need to get screening once a year, and I would recommend that they get a mammogram.
So would you have to maybe pair yourself with somebody that has more knowledge in how to screen somebody with implants versus, or would every practitioner really learns and becomes trained with this?
Yeah, so every year you get your physical done. Whether it's your OBGYN or your family doctor, they're going to do a breast exam, and they'll palpate around the breast to see if there's anything abnormal there. Whether you have implants or not, they're still knowledgeable and they're still able to do the same thing. And then just based on that, getting a mammogram. So you don't need any additional specialty testing other than just a routine, breast exam by a doctor as well as a mammogram yearly.
All right, well, those are all great things to keep in mind. We certainly thank you for joining us on Bloom today and sharing all of this knowledge with us. And if you would like more information, you can visit Dr. Gandhi's website at reviveatlantamd.com. That's reviveatlmd.com. And we're going to be back with more Bloom. Stay tuned.